Hello and welcome once again to this channel, Clinic Wahala by yours truly, Dr. Catch. Last time out we talked about arthritis. We laid a foundation for arthritis, what arthritis means, the fact that it's the commonest, osteoarthritis is the commonest arthritis. We also mentioned that it's a degenerative disease, meaning that as we age, this tends to occur because of wear and tear of our activities. We also talked about things that make arthritis happen and happen faster in people. We mentioned weight, obesity, having to carry more weight on a joint than it's supposed to be. We talked about those that do high impact sports and exercise, those that get injuries to these joints and we're not taken care of. Then maybe those born with bone joint or key leg, that's what we know it. But in medical parlance, we say genu valgum and genu varus. So those things alter the alignment of the joints and tend to make arthritis happen faster. So having laid that foundation, we also mentioned that the features or the symptoms we see in arthritis, the excessive pain that happens when we move, walk or do activities, the reduced range of movement, you can't extend or flex those joints very well. The stiffness that happens in the morning when we wake up, we can take up to 30 minutes trying to stretch out the legs. Then the swelling that can also follow this arthritis. So today we're going to finish it up. I will try to run as fast as I can so we tackle everything. Yes, when all these things happen, it's good you see your doctor. This is not the time to run and go and meet herbalist or traditional bone setter so that they can change the bow leg to key leg. They'll just help you and dismember your joints. So please do not head that way if you have this. So I also mentioned that it's not also the time for you to go to pharmacy and they'll be packing pain medications and giving you pain medications that can harm your intestines, perforate it, cause bleeding from the digestive tract, pain medications that can worsen your BP control, worsen your heart failure, scatter your kidneys. It's not the time to do that. I already mentioned in earlier videos that arthritis does not go with those pain medications. No, it doesn't. You take your pain medications, they have a time of action and hours when they are in the system acting. When they exhaust those hours, they are excreted and you are back to square one. They really do not heal the arthritis. It's a wear and tear problem. That place have worn out. So taking those drugs is not the way to go. So you need to see your doctor who will evaluate you. An orthopedic surgeon should be the best bet for that, who will take a look at it. An x-ray can be done. An x-ray will show you, that's the common one we do, to show you changes in the joints that confirm that this is arthritis happening. Yes, and let's move over to handle this arthritis. So what can you do? I already mentioned that yes, there are pain medications that can be applied on those joints, but it's good that your doctor sees that. The thing with medical practice is not just about knowing what to give. Of course, if you go to a mechanic shop or a mechanic is attached to an engineer who fabricated the vehicle knows how to get around the biggest problems in the vehicle. But somebody who is an apprentice and watching him fix problems, over time will think that, when this happens, I'll put this one. And he thinks he knows it all. But when a bigger problem that has to do with the structure of the car comes up, it becomes a problem for the apprentice. So it's not by running to a pharmacy or going to a bone setter. It's good you go to the person who officially specialized in this, who is the orthopedic surgeon. He will give you direction and he will give you the best treatment option. But what can you do? For me, I always advise for pain, paracetamol or Panadol is the way to go. When you do that and it's not solving the matter, you should see your doctor. Don't go and fire those NSAIDs, non-steroidal anti-inflammatory drugs. They have plenty side effects. If your doctor is giving it to you, your doctor knows the things to do to protect you against these things, and it's only for a short time. Then what can you do that are not drugs? Firstly, you need to lose weight. Say I've been mentioning it all this while about exercise and weight loss. You think I'm joking? I'm not joking. That's why at 40, many of us already have some arthritis features. I'm not exempted because I told you I'm overweight, so I'm working on my own. I'm almost touching obesity, so I'm working on my own. I already have joint pain, and I know arthritis is knocking by the corner. I don't want it to come and build house on my head though. So you need to lose weight. You need to lose weight because arthritis speeds up faster when there's so much weight the body is putting on it. That weight in your body is being supported and carried by your knees and even the joints at the back, the hip, the ankles. So the more the weight, the more the friction. So you need to lose weight. Losing weight alone can help reduce pain and your need for pain medications. What again can you do? When you walk and the pain is much and the place is hot, you can actually use cold compress with ice or very cool water and calm the joints down. That will reduce your requirement for drugs. What again can you do? Whereas I mentioned that high impact exercise worsens arthritis, but one of the treatment of arthritis is also exercise. Yes, one of the treatments is exercise. The joints, example, I'm using the knee joint as an example. There are muscles, natural muscles of the body that cuts across the knee joint. So when you do mild exercise like walking and make it regular, those muscles that wrap around the joints become stronger. When they are stronger, they hold these joints together. If you hold the joints together, you reduce the friction that happens when you walk, and the pain reduces. Arthritis pain reduces. Your need for drugs will also reduce. That also points to the fact that you see people who use these, we call it splints, joint splints. But if you see these people that do exercise and play sports, professional sports, they wear, example for the knee, I'm using the knee because it's a common one. There is something they wear, an elastic thing they wrap around their knees to hold their knees in place. That's also very good for arthritis. When you are going about your activities, walking and doing all these things, you need, if you strap it across your knees, it holds the knees together so that the friction therein will be limited and pain will reduce too. So splints are very important. The next thing, we've talked about muscle training, occupational changes. If you do an occupation where you carry heavy things and you have arthritis of the knee, wahala, you need to actually change. You need to tell them so they adjust that. Or if you need to be climbing 5 stories with a knee arthritis, it's not possible. So you need to ask that they shall adjust your occupation so that you don't strain yourself this much and strain those joints that much. That will reduce the pain and reduce the need for medicine. Also in the house, those that live in high mansions, some people use it to laugh at other people and say, when you are building this your high-rise building as your house in the village and arthritis sets in, who is going to live upstairs? So please make downstairs as comfortable as possible. Have a serious master bedroom downstairs once you are aging, so that you don't need to climb stairs to do so much when you start having knee arthritis. Is important. Then you see those men and women who use walking sticks, and some people will be laughing at them and say that they are crippled. It's you that is crippled in the mind though, because that's actually one of the treatments of arthritis. You are unloading the joint. When you use a walking stick, as you put the walking stick and walk, the weight of the body, part of the weight of the body goes to the walking stick and relieves the joint of that enormous weight it's supposed to carry. That is common sense. You look at it as walking stick, but that is wisdom. That is part of the thing. So papa, mama, do not listen to them if they say that you're using walking stick, you are crippled before your time. No, save yourself the pain too, and wear use your walking stick and relieve yourself of that pain that comes from arthritis. If you do that, you will see the difference. It doesn't mean anything if you're using a walking stick and one other old man or woman in the house is not using it. No, it's about your health. You need to make the right decisions. Now you the pain will worry. So make the right decisions and use your walking stick. Flex it. In fact, get a fancy one if you can and use it and do shakara. So that's it. So there are so many other things to do. I mentioned that the drugs do not really cure this arthritis because these things have worn out. You can't really cure it, but you can relieve the pain and reduce the frequency at which you have pain. The thing that can possibly remove or cure this arthritis are the surgical options. Yes, surgery. There are things called knee replacement where an artificial knee, as in that's your knee that has worn and torn for a long time, can be removed and an artificial knee, so to say, is put in so that all the pain and everything vanishes from there. It's possible. Some people fuse the joints so that they will not be doing croak on each other and causing you pain because of the friction. So many surgical procedures can bring a cure to osteoarthritis of some of these joints. So that's the thing that actually cures. So if you are going to a pharmacy and a pharmacist is promising you cure with his medication, run no. Those drugs do not cure arthritis. They may even have bad effects on your organs and systems, so you should be very careful. I believe at this point we will call it quits with this particular video, and I believe you've learned a lot. Please do well to forward this to your friends, to your family, to your colleagues. Part of the essence of this channel is these are the things we sit down to talk with our patients in the hospital one-on-one. So, but we want to bring it to the public like this so that I don't need to just tell one person in the ward or one person in the clinic and it's only that person that will hear it. I expect that you not only like this video and subscribe to this channel, but particularly send it to your friends, to your family, to your mother, to your father, to all the elderly people you know who are already experiencing arthritis or going to experience arthritis, so that they can take the necessary actions so that they can manage the arthritis well. So if the message spreads and stops many people from having arthritis, stops many people from taking all these drugs from pharmacy and damaging their kidneys and liver and heart, my work is done and I'll be glad because of that. So thank you once again. Don't forget to like, share and subscribe to this channel. Thank you for being here. Have a very wonderful day.